Good afternoon. My name is Margaret Akinola, and today I'll be presenting the findings from the study titled Despite an Overall Decline in U.S. Infant Mortality Rates, the Black/White Disparity Persists, Recent Trends and Future Projections by Shonda Loggins and Faliva Christina Drumhold Andrea. Infant mortality rates, or also known as IMRs, are an essential indicator of public health. Although the United States have seen an overall improvement in these rates, and persistent and significant racial disparities still remain. This presentation will show the factors driving the inequality, the study's methods and results, and potential sociological explanations, concluding with some insights at the end. For the descriptive statistics, the study analyzes MIRs, also known as infant mortality rates, among Black and white mothers between 1995 and 2009. In the table for Table 1 that's provided in the article, it shows the breakdown of births and infant deaths categorized by race, maternal status, and educational attainment. While this study reveals a significant decline in infant mortality rates over the period of both groups, the disparity remains glaring. For example, Black mothers consistently experience infant mortality rates that are 2 to 3 times higher than those of white mothers. This data incites a troubling systematic issue. Even as healthcare improves overall, Black mothers and their infants continue to face unique barriers that place them at a greater risk of infant mortality. For the procedures, the study's central hypothesis is that race is intricately linked to social economic factors causing this disparity. This suggests that disparities is fundamentally racial. The researchers used a robust data set from the CDC's linked birth and infant death files, covering all 50 states from 1995 to 2009. This data set allows for a comprehensive analysis of how social economic indicators such as income, education, and employment interact with race and influence infant mortality rates by focusing on Black and white mothers. Specifically, the researchers were able to examine these disparities within the broader racial and social economic landscape of the United States. For the results of the study are very shocking. Although both Black and white mothers saw improvements in infant mortality rates between 1995 and 2009, the disparity still persists. Black mothers, on average, experience significant higher rates of infant mortality rate than white mothers overall. This findings reveals more than just numbers. They reflect the lived realities of systematic inequalities and Black women. Despite progress in reducing infant deaths, the unequal burden borne by Black mothers underscored the urgent need for targeted interventions. For my explanation conclusion, the study argues that the persistent disparity is largely due to social economic inequalities that disproportionately affect the Black population. For example, Black mothers are more likely to face challenges such as limited access to quality health care, lower levels of education, lower income, even higher unemployment rates. These factors combine to increase the stress levels, which is directly linked to poor health outcomes during pregnancy and infancy. The conclusion talks about while improvements in healthcare and overall infant mortality rates are encouraging, the systematic factors that that impact Black mothers must be addressed. Efforts to improve healthcare access, reduce social economic disparities, and create a and combat structural racism are essential for closing this gap. And then here are my references. Any questions?
Okay. What additional factors beyond socioeconomic status could be contributing to racial disparities in MRIs?
Systematic racism in healthcare inflicts biases, environmental hazards in Black communities, and cultural mistrust of the medical system, contributing significantly.
Okay, thank you. And how might policies focus on maternal health care access help close the gap in IMRs?
I believe expanding Medicaid, increasing access to prenatal and postnatal care, and funding programs that serve underdeveloped communities can reduce disparities.
Okay. And lastly, what specific interventions could be most effective in reducing stress and improving health outcomes among Black mothers?
Providing access to doula services or midwives, basically anything affordable, like affordable mental health resources and economic support, like paid family leave, can directly improve the outcome of these situations.
Okay.
Thank you.